Thank you, Mr. President. Excellencies, dear colleagues and friends, thank you for inviting WHO to speak at this very crucial dialogue. On behalf of Director General Dr. Tedros, I would like to express our sincere appreciation to Your Excellency, Mr. President. The issues in front of us today are deeply interconnected and central to WHO mission. The evidence is clear. The climate crisis is a health crisis. It is not a future threat. It is here and now. Climate change are driving more frequent and extreme weather events, spreading diseases like cholera, dengue, and malaria, increasing heat-related illness, non-communicable diseases, and mental health conditions. Climate change is a major driver for malnutrition, food insecurity, foodborne diseases, and it impacts water supply. Climate-related emergencies and health security threats, including pandemic threat, are growing. The same emissions killing our planet are also killing our people. Climate crisis, pollution, and biodiversity loss are putting people's health at high risk. Air pollution alone kills 7 million people every year. I confirm that this refers to premature deaths. Of course, we have different methodology with focus on different aspects of estimation. 3 billion people cannot afford healthy diets, and climate change is further undermining food security, disrupted agriculture productivity, and the food value chains impact the availability, accessibility, affordability, and the quality of food directly impact people's health. The right to health is at risk. Excellencies, dear colleagues, addressing the link of climate change, food security, and health security also means our fight against climate change and transforming our food and health system should go together hand in hand. These highly interconnected issues more significantly affect people already in vulnerable situations. For example, climate change affects women's health disproportionately due to their greater participation in small agriculture and their increased exposure to food and water insecurity. Climate change is also driving migration and displacement, with migrants often facing significant barriers to access health services. Indigenous populations and their health are particularly vulnerable due to their dependence to the natural resources and living in climate-sensitive areas. Extreme heat waves more intensively affect older population, those in poor living conditions, for example, without air conditioning, and outdoor workers, sometimes with fatal outcomes. Excellencies, dear colleagues, the right to health is fundamental. Just to remind all of us, when the Constitution of World Health Organization entered into force in April 1948, which means 76 years ago, it states that health is human right without distinction of race, religion, political belief, economic and social condition. Today, I would like to highlight 3 key aspects of our new global health agenda that are highly relevant to our dialogue. First, the right to health is a core element of our newly endorsed global health strategy for 2025 and 2028. We called the WHO 14th General Program of Work, or JPW 14. This strategy aims to promote, provide, and protect health and well-being for all people, everywhere, at all the times. Health equity is at the center of this agenda. Second, addressing climate change and its health impact is now at the first strategic objective, recognize its critical link to the health security and sustainability of food and health systems. Third, the new global health strategy emphasizes the connection between food security and health security, prioritizing the co-creation of healthier and sustainable food system for everyone. Excellencies, dear colleagues, mitigating the health and other impacts of climate change, food security, and health security requires stronger approaches, including applying One Health approach that connects evidence-based policy intervention, sustainable financing, community action, and innovative solution. To do that one, we call for solidarity. Actions we take today will determine the health and security of our, and more important, future generations. WHO works closely with member states and the UN families and partners to realize our common ambition of promoting, providing, and protecting health and well-being for all people, everyone. Thank you, Mr. President.